Hello, I'm Dr. R.D. Khare, a pediatrician. I've been practicing pediatrician for about 50 years and have been a teaching faculty in different medical colleges for about 20 years. Here we are to learn the importance of history taking. As somebody has said, the diagnosis is written in history. So let us start with history. And the first thing would be name, age and sex. Nothing much about the name and sex, but about the age. If the child is less than 1 month of age, the age should be in days, and if his age is less than 3 days, then it should be in hours, because you know that onset of neonatal jaundice or onset of seizure disorder in a newborn has a lot to do with the time at which it has started. Then we come to the chief complaint and ask him what was it for, what is the duration. Now if the chief complaint is single, then we will proceed how to go. But if the chief complaints are multiple, we will see that a little later. After listening to his complaint, we ask him, was he absolutely alright before that? Because the patient may think that this was not very important in the light of the present complaint which is uppermost in mind, but to us the past complaint may reveal that he was not absolutely alright. He had some breathlessness on walking, or the child was not ready to play for a long time, used to come back after playing though he liked to play, or there has been recent loss of weight and the appetite is going down, thereby telling us that the illness has started much earlier, and that may have some bearing on the chief complaint that the child has or the patient has now. Now we come to single chief complaint and start with onset, duration and progress. Let's take onset first. Onset can be sudden in matter of minutes, something like explosive, or it can be acute, or subacute or chronic. Sudden or explosive onset can be trauma. For example, a 1.5-year-old child was playing with his 6-year-old brother, and suddenly child started crying, and it was noticed that he had a pulled elbow, though there was no apparent trauma. Sudden onset can also be there as a result of vascular accident. A 60-year-old man was watching television, had sudden onset of headache and vomiting, and he found that his right side of the body was not moving. This is likely to be a vascular accident, maybe a hemorrhage or embolism. Thrombosis does not have such a sudden event. Or it can be a mechanical problem. For example, child started coughing incessantly for last about 1.5 days. He was not coughing at all before the cough started. It could be inhalation of a foreign body. Or a 60-year-old asthmatic had severe right-sided chest pain and he became breathless. It could be a pneumothorax. You know that anaphylaxis and seizure disorders also have a sudden onset. Then we go to acute onset, which we can say over a period of hours, or it can be subacute period of days, or it can be longer. Now a child may have sudden onset over a period of few hours in bronchiolitis or asthma, while an adult may become breathless over a period of few days, which may be the beginning of a pneumonia. Or an elderly person may have a slow onset of breathlessness which is progressive, which may be interstitial lung disease. So we have different onset. When there are more than one chief complaint, then we ask him, out of the 3 complaints that a patient has made, which is the most important and chief complaint to him? And after analyzing this chief complaint, we also take into action the other complaint. To give you an example, 3 6-year-old children were brought for fever, vomiting and abdominal pain. First child had fever as the first complaint, and vomiting and abdominal pain was not so very important. This was a case of acute gastrointestinal infection. While the second child had vomiting as the chief complaint and abdominal pain and fever very mild, it could be beginning of a hepatitis. While the third child had very mild fever and vomited just 2 or 3 times, but the severe abdominal pain was his main complaint, which could be an acute appendicitis. Now, when patient has more than one chief complaint, and according to all the 3 complaints are important, not one over the other, then we find out and we go according to the onset of this. Now, for example, 3 6-month-old children were brought for fever, vomiting and loose motions. Now, first child, the fever started first, followed by vomiting and loose motions. This was acute gastroenteritis. While the second child started with fever and loose motions, while the loose motions stopped in a few hours and vomiting started later. Now, delayed onset of vomiting in the persistence of fever could be a systemic disorder, which could be even urinary tract infection. The loose motions were a part of parenteral diarrhea. So, having done that, we come now to the progress of an illness. Now, progress can be, a patient can be improving, he can be stationary, or he can be deteriorating. Improvement over a period of short duration of 4 to 5 days can be as a result of self-limiting viral infections, or with treatment the improvement has ensued. A sub-acute or a static progress can be when there is a one-time insult as a result of which some symptoms have developed and no more. For example, as a result of birth asphyxia, the child has cerebral palsy, and thereafter the disease is not progressive, or an adult may have a hemiplegia, which was a sudden onset event. After that, the hemiplegia has neither worsened nor improved. While progressively worsening illness can be a chronic progressive infection or an immunological disorder or malignancy. So this is how we decide from the origin, duration and progress what is likely to be the kind of illness that we are dealing with. Thank you very much. The next topic will be by Dr. Tushar Mania on how relevant is the side list. Thank you.